95 response. The reason why I'm just going to be speaking for a 3-year-old male, it's going to be STAR kid number 8.
The STARS program focuses on what we call special needs patients. These are patients that have medical needs beyond what you see generally in the general pediatric population. These can be kids with tracheostomies, breathing tubes, feeding tubes, complex medical problems, multiple different complex medical problems.
Suction trach if needed. He is vent dependent.
STARS is an acronym for Special Needs Tracking and Awareness Response System. I've been a paramedic for a long time. These kids were challenging. We train typically on healthy children. Those are not the children who are likely to have a medical emergency.
STARS in its simplest form is just a way for providers to know what they should expect and what they might encounter before they even arrive on scene for these children with special health care needs.
Some of those calls that are more serious in general can be hectic as it is, so then you add a specialty need or specialty skill or specialty device on top of that, and that just adds to your panic.
Riley was born at 23 weeks and 4 days. She has chronic lung disease, hence why she has her trach. I've seen her blue 1,001 times, but there's something different from being in a hospital when you have that code blue button than being home. When I put the monitor on her, I think her sats were about 60 going down like fast. She was dropping pretty fast. And at that point, I'm like, okay, we're gonna go ahead and call the ambulance.
That call popped up and it popped up STARS. So right away, the STARS notes, every bit of information that we were needing for that call was on there. Before we even got on the call, I knew parents' names, child's name, to conditions, what the bag, everything was right there. We walked in confident, we walked in knowing what we were doing, and we went right basic, following the steps. The sheets are broke down so nice and easy for you that we literally just followed exactly how it went, and it just started to work out.
Whenever they got there, it was like a relief, like, okay, well, I'm already freaked out enough. I'm just glad that they know Riley. They know she has a trach, a G-tube. They know what to suction her to, what kind of trach she has. It was nice to know that they were taking her into the ambulance and we were waiting out there like, okay, they got it. They got this. They know Riley.
This is extremely important because these aren't things that you learn as an emergency medical responder. So they might be responding to a patient who has multiple things going on, and if it's not an adult with a heart attack or some other things that are more common, it could be very difficult for them to manage that child.
It was on December the 10th of 2007 that he was diagnosed with lissencephaly. All we heard was he will never walk, he will never talk, he will never sit up on his own, he will have seizures every day.
Everything was sort of on us to educate. We would go to like local, our local ambulance, or we had to proactively do things like that. Say, hey, we want to make you aware of of our situations.
What STARS did is helped kind of remove that burden. It means that I can actually call 911 and potentially be his mom, because if I'm calling 911, that means I know I can't get him to Cardinal Glen in enough time, and I am scared to death for my son. And that's the scariest part.
His care requires a lot of different people. You have to work with medical professionals, you got to work with family. It really does take a village.
STARS speaks their language, where as much as we do know, we're still parents.
Mm-hmm.
We do not have a medical background. I have a medical background in Kellen.
Yeah.
Funding is essential. STARS truly would not exist without the initiation of the foundation support, and any perceived expansion has to come through additional donor support.
We need hands on deck. We need to be able to utilize that database to its full potential. We're going to need people on the ground training people on how to use a database. We're going to need IT people working in the system itself, people to enter data, a true team, a true group of people here running STARS.
It really is such an important component of how we're able to serve really patients coming both from St. Louis itself as well as outlying cities, and then hundreds of miles, rural communities as well as other cities in every direction.
It took us a long time to really just open up and trust other people and just not want to do it by ourselves. You're going to have to trust these people, support them in any way you can, because at some point in time they're going to become very important.
It truly is an important program, and I truly feel that As the training officer here, we will make sure that we have this program every year, that we need to have a refresher, updates, and stuff like that. But if anybody does not have that has STARS patients in their community, they're missing the boat here.
Each time you have a positive impact between that provider and that family and that patient, and care is provided that you know wouldn't have been provided without this kind of training and education. I don't think you can really put a number on that. How big of an impact is that when you can say, hey, these kids would have died had we didn't have this kind of training? I think that's kind of about all you can say.